All the surgeries are done at Roger Williams Medical Center because this is the center of excellence, and we have to do them here, and we want to do them here because all the equipment is here, and that's the center of excellence. All the surgeries are done with something called laparoscopic. That means you're going to have general anesthesia, you will be asleep, and then we usually use 5 small incisions. Okay? 5 small incisions. Most of them are 1/4 of an inch. They're 1 or 2 or 1/2 an inch big. They go a little bit zigzag across your belly. So 5 small incisions. And then we do all these surgeries. There's 5 for the bypass, the sleeve, and for the band. And we're going to talk about the different surgeries here. All right, so I'm going to be talking about the bypass, then Dr. Blumenthal will talk about the sleeve, and then I'll talk again about the band. And we both, Dr. Blumenthal, we both do these two. It's just not just because I talk about the bypass means I do all the bypasses, he does all the sleeves. We both do both. So if you choose your surgeon, it doesn't matter which procedure you want. All right, so for the gastric bypass. So as you can see, the top one is the stomach, and then it goes down to the small intestine. There's about 25 feet of small intestine. And you can see all these colors here. This is color-coded, it's just on the slide. This is not inside of you. Inside of you, all the intestine looks the same, nice and pink. This is just here for demonstration. So the first thing that we'll do is we'll make a little new stomach up here. We'll cut through the stomach. So your new stomach is going to be as big as my thumb. Okay, this is going to be a new stomach, 1/2 ounce to 1 ounce in size. And then we're going to measure down the intestines to where the blue and the green meet. And then we'll cut here, cut the intestines there. And then keep measuring down the green, down to where the green and the yellow meet. And then we're going to attach the blue down here. So basically the top part gets pulled down lower, and the lower part, the green here, then gets pulled up to the pouch. All right, so this is the end result. The food will come in here, go into the food pipe, and from the food pipe up here, it goes to the small pouch, and then it has to squeeze through a small opening into the intestines. Then it goes through that green intestine, and that green intestine is special because it doesn't have any juices anymore that digest the food. So the food does not get broken up into the little tiny proteins and fats and sugars, so it doesn't get absorbed as well. So you're not absorbing the calories. It's called malabsorption. Okay? But unfortunately, you're also not absorbing vitamins and minerals, so patients with a gastric bypass always have to take vitamins and minerals for the rest of their life. So the first effect of the gastric bypass is this restriction, where you can't eat big portions, it's small portions. The second effect is that malabsorption, where you don't absorb the calories. That unfortunately goes away over the years for the calories. And the third effect is changes in the hormones of the body. In particular, the hormones that regulate the hunger. That's called the ghrelin hormone. That's the hunger hormone, and that goes way down after gastric bypass. So the effect is that you're actually not hungry. For the first year, at least after surgery, most people are not hungry at all. They could care less about eating. And that's a big change from where most people are right now. Sometimes people have to set the clock, the alarm, so oh my God, it's lunchtime, I gotta eat something. Otherwise they forget. So that's because of the ghrelin. And then the second hormones are the ones that regulate the blood sugar. So that's the good thing for people particularly who have diabetes. Because for them, the diabetes sometimes goes away even within a few days after surgery. They don't even have to lose weight. The diabetes just goes away. And if they keep the weight off, it stays away. Someone who has a lot of issues with blood sugars, who takes like 500 units of insulin and had it for 10 years, for them the sugar will get better, but it most likely will not go completely away. But it's a great surgery for diabetes, to the point even that some endocrinologists and some other doctors think that this is a good surgery just as a treatment for diabetes. Not just for weight loss, but just as a treatment for diabetes. Nothing is going there. Things are flowing down from the old, even that old part of the stomach, the big part of the stomach, it stays in there. It doesn't go away, it doesn't shrink, doesn't rot, so it can stay in there safely. It still makes little juices, and the red part of the intestine actually makes all the good juices that you need to digest the food. So they flow down into the blue and then into the yellow, and then they help digest food, because if you didn't have those, you wouldn't digest anything. So everything is still connected, everything is still flowing down, and that's the way you need it. And we don't take anything out. So some people think we take things out of the stomach with a bypass. We don't take anything out. Okay, it's all staying inside, just going to be rearranged. Question is, why do we bypass the part that absorbs the minerals and vitamins? Because that's the same part that absorbs the calories. So you cannot separate those two. It's either both or none. So the question is, if you have to go for an endoscopy or a colonoscopy, is the process the same? For colonoscopy, yes, you can drink that whole nasty gallon that you have to drink, yes. And there's no problem. Yeah, people always ask, well, can I drink enough water afterwards? Well, not the first week or month or 2 months, but later on in life, you can drink normal. We have people who run marathons on the bypass, and they hydrate plenty, so you can drink enough. So colonoscopy will be no problems. And with this surgery, we do not touch the colon. This has nothing to do with the colon. So people always wonder, if I have diverticulitis, is there a problem? There's no problem with this. Okay, it's all small intestine and the stomach. Now for the endoscopy, for the upper endoscopy, you can only look into the small pouch. Okay, you cannot look into the old stomach anymore, at least for most people. There is a doctor here at this hospital actually who invented a device where he can actually look all the way down and then back. So he can look into the old part of the stomach, but not the easy way that you usually do.